Welcome to Med Madness podcast, where we delve into critical medical topics with clarity and depth. Today we're exploring the fascinating world of twin pregnancies, specifically focusing on ultrasound findings in dichorionic-diamniotic, or DCDA, twin gestation. We'll guide you through the key ultrasound signs that help distinguish between different types of twins and how this knowledge shapes clinical practice. Let's dive right in. Twins can be categorized into three main types: dichorionic-diamniotic, DCDA, monochorionic-diamniotic, MCDA, and monochorionic monoamniotic, MCMA. Each type has distinct characteristics and associated risks, making early and accurate identification crucial for optimal prenatal care. DCDA twins, which we'll focus on today, are characterized by having two separate chorions and amniotic sacs. Each fetus in a DCDA twin pregnancy has its own placenta, either distinct or closely situated but not fused. Next, let's discuss the optimal timing for determining chorionicity and amnionicity, which is between 10 and 14 weeks of gestation. During this period, ultrasound imaging provides the clearest differentiation between DCDA and other twin types. One of the hallmark signs of DCDA twin pregnancies is the twin peak, or Lambda sign. This sign appears as a triangular projection of placental tissue at the base of the intertwin membrane, indicative of two separate placental structures. It is best visualized in the first trimester, particularly around 10 to 14 weeks. In contrast, the T sign is associated with monochorionic pregnancies, where the intertwin membrane forms a T-shaped junction with the placenta, indicating a single shared placenta. The presence of the twin peak sign and the absence of the T sign help in distinguishing DCDA twins from MCDA twins, which share a placenta. The intertwin membrane's thickness also provides valuable clues. In DCDA pregnancies, this membrane is usually thicker, measuring over 2 mm, due to the presence of two chorionic layers. This is another distinguishing feature from MCDA twins, which have a thinner intertwin membrane. Visualizing two separate amniotic sacs confirms the diamniotic nature of the pregnancy. Each fetus has its own amniotic sac, contributing to the presence of two distinct gestational sacs on the ultrasound. This separation helps lower the risks of complications compared to monochorionic twins, making DCDA pregnancies generally safer. Regular ultrasound monitoring is essential to assess growth, development, and potential complications in DCDA twin pregnancies. Early detection of chorionicity guides prenatal care and surveillance strategies, allowing for tailored management to mitigate risks such as preterm birth, preeclampsia, and growth discordance. DCDA twins, for instance, have a lower risk of twin-to-twin transfusion syndrome, TTTS, compared to MCDA twins, which can be a significant concern. Now, let's discuss a real-life case study that highlights the importance of early and accurate ultrasound identification in twin pregnancies. A 28-year-old woman at 12 weeks gestation came in for her routine prenatal ultrasound. The sonographer identified two fetuses, each in its own amniotic sac. The ultrasound clearly showed the twin peak sign, indicating a dichorionic-diamniotic twin pregnancy. The separate placentas and thick intertwin membrane further confirmed the diagnosis. Thanks to early identification, the healthcare team was able to establish an appropriate monitoring schedule, focusing on growth assessments and potential complications specific to DCDA twins. The patient received regular ultrasounds every 4 weeks, allowing the team to track fetal development closely. By 36 weeks, both babies were healthy, and the patient delivered 2 healthy infants via caesarean section with no major complications during the pregnancy. This case underscores the critical role of early and accurate ultrasound in managing twin pregnancies. It ensures that both the mother and her twins receive the best possible care tailored to their specific needs. Thank you for joining us on Med Madness podcast. We hope this episode has provided valuable insights into the ultrasound findings in dichorionic-diamniotic twin gestation. Stay tuned for more in-depth discussions on key medical topics. If you have any questions or comments, we'd love to hear from you. Until next time, stay curious and stay informed. For more lifelike voices, higher character limits, and dubbing content in other languages, head to 11labs.io.utm source 11labs GPT.